let's call this meeting to order at 5:00 p.m. And let's stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. All right, we've got 4 out of 5 board members, so we have a quorum. Oh, I didn't know I was going to get this.
It's their new.
I didn't sit down before. Okay, so you, Adam Licky, received the official notices of meeting.
Yes.
Any changes to the regular meeting minutes from August 23rd, 2023? Okay, is there a motion to accept the meeting minutes?
I so move.
Motion by Dr. Hendrickson, a second.
Second.
Second by Dr. Jones, all in favor?
Aye.
Aye. Opposed? Abstentions, and that motion passes. All right, moving on to the population health report.
No additional details unless anybody has any questions.
Yeah, I just had a question about, it says Geauga does not qualify for the Get Vaccinated Ohio grant. Can
Yes.
you provide a little more detail about that?
Yeah, so that was the one, actually back in April, I think, when we first talked about it. So the state has a criteria of where you're eligible when you're not. We've fallen below the eligibility threshold for how they calculate it. So you have to be,
So you qualify, but you can't administer it or
yeah.
acquisition it without a partner.
And I'm trying to think, I think it's $30,000 threshold, and we're just below that threshold of like 28,000 or 27,000. So we cannot have the grant on our own. Technical difficulties.
It's very low, sorry.
So at that point, the state said, we have a couple options, one of which is to have the grant housed by somebody else, which was Lake, and then we're a subsidiary of that grant where it flows through us through Lake, or to us through Lake. So unfortunately, I'm hoping that does not become more common, but we are on the low end for at least the one grant we had. The other grants are mostly gone except for FEP, Safe Communities, and workforce development, yeah, which is it's not a consistent grant, it's a one-time grant as of right now.
Can you give a little overview on the increase in COVID? And I don't know if you want to do it now or under the health commissioner's report. I'm just interested, I mean, it's almost a 400% increase.
Yeah, I mean, we've seen increases, and I think Dr. Rood spoke to it last time, and I think I had someone else speak to it as well. We're seeing the increases, but we're not seeing the hospitalizations, the deaths, things like that.
Yeah, new variants prevalent moving out there, but it's again, normally similar to any other flu or RSV or those kind of things, but it has increased, but again, we're indoors, and more people get indoors, back into business, house, parties, school. It usually, sometimes it'll go 400%, if it's not that, it'll be flu.
Okay, are we administering the COVID vaccine, the booster?
We're not right now, so it's going to be a private vaccine moving forward, which we don't really handle. We usually handle free vaccine.
Okay.
And then honestly, when we have the Walgreens, the CVS's, the Walmarts of the world, it's a lot easier to say, hey, you guys can go there, you get the vaccine through there, versus trying to come to us, because right now we're mostly focusing on the DDC and then other mobile clinics as well, but mostly focusing on that.
Okay.
That's where our pocket of need is the health department.
That's fair.
Yes.
Okay.
Yeah.
Actually, if I don't mind, I'll just add to
Thank
that,
you.
the
Easy to forget.
Safe Communities grant, we have some unspent dollars, and GBO unspent dollars that are gonna go back to the state, primarily because we don't have the staff to do it. So you look at staff, they get 100% of their salary. We have 130% available in grants, but if we don't have a body, we can't pay for it. So the GBO grants, about half of it is more Safe Communities. So I think it's used about 27,000. I think we spent 14,000 of the 23 GBO grant, leaving some on there. And the Safe Communities, we've only billed like 30 or so of that, and then you got about 20,000 that we can't spend unless we add it to staffing. So that'll be returned.
And GBO, we also have the problem with Get Vaccine Ohio, where the doctor's offices that we need to go into generally aren't hospital for us coming in. That was a problem before. Now is we can't claim a lot of dollars because we can't get into some of those those sites.
Yeah.
So it's not like just to Geauga County. It's common elsewhere too. It's one more oversight thing they have to deal with, one more red tape.
So we'll prepare some of this next month just as more detailed provisions so we know that the grants are going, where they're going, and the gaps in between, so you guys can make a better decision. In the meantime, we're applying for the grants, still bringing in money as an opportunity. But staff's mostly in the FIP grant, the preparedness grant, workforce kind of cleans up most of that, and then you box out on any other additional funds.
All right. Any other questions on population health? Moving on to EH, Mr. Lark.
You'll see there's something, we have a couple referrals in the packet today, and also some updates I can give if you want when you're looking at those ones, but we should have some updates on those, and then, did you want to talk about fees now?
Yeah, so I put the fees on the screen behind you guys. I'm gonna have Dan kind of go over this. We're not actually voting on these or recommending them until next meeting, but I know some of you haven't gone through a food fee reading before, so I'd like to make sure you are understanding of where we're going, how we do it, and things like that nature. So I'll let Dan talk about it.
So the food fees are based on the actual time staff spends doing inspections on restaurants, plus a percentage that's based for administrative support. So what, what's it?
The cap, there's a limit to it, right?
30% cap.
Yeah.
Yes,
Okay.
yeah.
It's
there's
30% cap.
Yes,
On admin.
and actually ours, I think, only came out at 23% this year. So it's based on a massive spreadsheet the state mandates you use for the food cost. So it's really, you put in your data, how much time the people spent, how much all of your expenses are, and it kind of pops out with answers. So it's not really, and you can go up to that maximum number. If you do the maximum numbers, that means you're recovering a lot of your costs. But the problem with the methodology they use is you're using 1 to 2 year old data to get all of your things done. So we're using this year's and last year's data to project out for next year. So you're always kind of behind the 8 ball a little bit and always really losing money in the program to a certain extent since you're using 2 year old data, 1 to 2 year old data. So what we've done is we're going to go through and actually the other thing that's made this even more interesting year too is the last, this is the first year where COVID time hasn't been a big factor for health department employees because a lot of time was spent in responding to COVID, whether it's running clinics, COVID letters or whatever we were doing at those times. Mm-hmm. So this is actually the first year when we've actually had a full year's worth of time for these staff. So the last couple of years, the numbers have been artificially low because we've had people not doing as much time as we really should have in the food program because of other responses. This year, what we're going to see is the actual costs come back to show up in the licensing fees. And so what the last couple of years has kind of been subsidized by the state by a grant they gave out to the health departments to help cover some of that cost because they had extra money in one of their funds that was supposed to support restaurants that the restaurants never applied for. So then they reallocated it to health departments just to support food staff. And so now we're at the point where there's going to be a proposal of a substantial jump in fees, but this is actually going to get us back up to where we are cost-wise. When we originally did them, I mean, we're 4 years behind on cost numbers, so we're trying to get ourselves back up to where we're actually covering our costs and not having like the tax layer or tax levy, kind of subsidize the restaurant fees.
And up until recently too, when Dan and I have done these for years, if you, so if the fee came out lower than next year, so let's say our fee's $100 this year, next year the spreadsheet says it should have been $95. You have to reduce your fee to $95. So in general, they were always like, hey, never be above what you think would be next year's like minimums. Mm-hmm. And when you have staff changing in and out, you have to account for if you don't know what's going to happen in a year. So we were talking during our food audit that just happened, which went very well, and one of the conversations was, why don't we just use the maximum number? Because the maximum number ensures that Susie taxpayer or John taxpayer is not paying for McDonald's to have their license fee, as an example. And we always thought this was this biggest slap on the wrist, it's a big to-do. And they're like, no, that's not at all how this goes. Like, we just tell you gotta reduce your fee. I said, oh, well then that makes a lot of sense. So different person, different approach on things, obviously. Mm-hmm. So like Dan said, as an example, the current and proposed for small there, we'll go from like 187 to 244 or 208 to 278. This is a one-time fee. They're not paying this like every month to us or every week. It's a one-time fee.
What does the number 1, 2, 3, 4 represent?
So it's a class 1, 2, 3, or 4.
Class.
Yes.
Okay.
And then there's based on square feet. There's large below it.
Okay.
down here, which is a different square footage
Okay.
number.
And non-commercial, example of a non-commercial food service?
School.
Yeah.
Okay,
And non-commercials are always exactly 50%. They're always exactly 50% of whatever the corresponding commercial one is. And then the two exceptions to what Dan's talking about is mobile temp and non-commercial temp, and I'll let Dan talk about those real quick.
So just real quick, vending, since that's really low, that is capped by the CPI. So we can't charge, so if it's 1% or 20%, that's all we can raise it. So that's kind of an oddity, and it's actually in the ORC specifically about vending licenses. So it's not even cost driven, it's we lose money on every single vending machine license. So the other ones, so we'll start at the bottom with temporaries and non-commercial. Temporaries are when an organization just wants to serve food, we have a fundraiser once a year.
Is that fair?
The fair, yeah, I think we had over 15 different temporaries. Yeah. And so they've been traditionally $60 here, and then non-commercial ones would be more like the Boy Scouts and $30. And the actual amount that it cost us was, it was substantially higher than
Maybe it
that
was
for
like
all this.
$640,
Yeah.
something like that.
So,
No.
but our.
But that would mean the Boy Scouts would go up to like $300,
Okay.
as an example.
So, but the reason that we're looking at keeping them, we're raising them substantially compared to the original cost of what our proposal is, but not what they are, because we still want to make it affordable for organizations. And we only do 14 of each, so it's not like it's going to make or break anything, I guess. So
Yeah.
we'd still lose some money on it, but a lot of times those are a lot of time because they're organizations that don't normally sell food.
Yeah.
And they don't know what they're doing, and so there's a lot of time spent educating them or making sure they have the right equipment. Or when we go to the site and when you see it's a big cluster, then you're there, go to Walmart right now and get X, Y, and Z, and then you're waiting for them to come back so they can operate safely. The mobile one is a substantial raise too, and those are like the trailers at the fairgrounds. Typically we issue a license, they get an inspection at the beginning of the food year, and then they go to all the different county fairs with their license. The cost on that is real substantial because we also, at these different fairs and festivals, staff is doing inspections on out-of-county mobiles. So you're spending a lot of time doing mobiles, which we don't necessarily license, but we're also going in to make sure that they're, they're selling safe food at the fairgrounds or the festivals and fairs.
same for food trucks that show up at
Food trucks would be considered a mobile.
mobile,
Mhm.
show up at gatherings.
Yep, yep.
So we try to be somewhat reasonable, because obviously there are some areas where you may do better, because if you have a bunch of teams out, they can knock out a bunch of them at one time. But if you have one you got to travel to, that's where it skyrockets the price, and the rest of them drag it down, so it's evening out. But Dan and I went over these with a lot of time and effort, and we think this is probably the way to go for these, where it makes it affordable, because, God forbid the Girl Scouts want to do a cookie thing or something like that, and then, it's like, oh, it's $300. Well, now you got to sell 1,000 hot dogs. Not cookies aren't a good example.
Yeah, cookies
but
are gonna be less.
That's what I was thinking.
like a hot dog. I said cookies. I'm like, I should have said hot dogs.
Yeah,
Like,
two, yeah.
something like that. And it's like I got to sell 1,000 hot dogs, and we got what the health department just charged me. So we don't want to
Or
do
they're
that.
just not even gonna bother getting.
Right, or they
the
say no,
license.
which we don't want that either.
Right,
That's
yeah.
that's how they go out and they do their thing. So obviously I want Girl Scout cookies right now is the problem with this whole thing. But anyways, we'll discuss these next time. We do 3 fee readings, so we'll do one October, November, and December to make them effective in January.
And we do have a public hearing, and part of the fee, is we do have a public hearing scheduled for, I think October
18th.
18th, thank you.
It's on the
letter. This one's the
Okay,
18th, yeah.
18th. So that's what these letters are for, you have in front of you, the one that's folded, is we have to send notice to everybody who's having their fees increased. So we sent out 500 some letters the other day, to every person that's licensed. And just one other fee that we are looking to raise is temporary campground fee. We've only had one this year, and we haven't had one in anybody's memory that we haven't had one the prior. But that's what temporary campground is. That's when it was what was it, $75?
Yeah, it was very low.
So we're looking to actually put it up to, was it 150?
Yeah, I think
Which
it
is
was
doubling,
like
but
10.
it's kind of an involved process because there's plan submittals, site visits, and then inspections on it, and 3 hours, 150 would be about 3 hours of time for one of the staff members, and that's probably even a little bit on the low side, to be honest.
We
But
kinda
we've
looked at-
had one in the last 10 years, and it was this year.
Yeah, we kind of looked at everything as if it's $50 an hour, which is a round number to catch like some of the highs and low staff. At $50 an hour, does that make sense? And that's kind of how we looked at some of these things where, you know, for that one, the staff, we figured it's 3 hours, so 3 times 150. So I think it was 2.5, and the other money would cover the gas or the, you know, the car type of thing, so.
Two quick questions. Have there been any, one about the food license and one about the fees for camping? Have there ever been any in Geauga County instances of a food entity operating without a license for some period of time and then getting discovered, or?
They didn't, someone didn't renew them, we had to get after them.
Yeah, I mean, every year we have probably 5 or 10 that we have to track down and
Some this year, I
take
think,
to
didn't
court.
we?
Yeah, we did.
For non-renewal?
The one went out of business.
Right.
Dan and I both actually did that this year, where we drove out to different places and took a couple of them and said, hey, I need this check like today,
I mean,
so you don't get fined.
And just because they're licensed doesn't mean they, on Friday night, actually, I got a call about 6 o'clock to one of our inspectors without an event. And we had to have a mobile unit leave the event because they came there without any way to wash their hands, any way to keep food hot or cold. And, you know, everything was at room temperature already, so we said, you know, we can't let you serve. So just because they're licensed, unfortunately, doesn't mean.
And it wasn't like it was something like chips, it was shrimp.
Right.
Oh.
That's gotta be tempt.
That's kind of dangerous.
Yeah, because my first question was, well, what were they serving? And it was like,
Right.
you know, it always like cheese balls. It's like, no, it was shrimp. I'm like,
Yeah.
probably one of the worst things
For
you
me.
could have. So,
And the camping fees, that doesn't include the Geauga County park system?
No, so this is a temporary
This
one,
is-
which is like a one-time event. So usually,
music festival.
yeah, usually you might have,
Yeah, I'm trying to think of examples.
like the carnival workers or carnies, whatever you want to
Okay,
have.
all right.
Like fair
Like
camping.
sometimes they set up a
Yeah,
temporary
okay.
camp where they,
On
a lot of
site.
times you see them at fairs and festivals,
Right,
the
you
workers
see
set up a
all
temporary
the-
camp.
Yeah.
And they have to
The
go like a
campers
temporary
and
license to
the
make sure they're handling their wastewater and drinking water appropriately.
Always fun.
Interesting.
Yeah. Dan leads a very exciting life. Just telling you.
He's very knowledgeable.
Things he
about all
sees.
this.
Like things other people don't think about.
Well, I'm certainly in favor with these, you know, aligning the fees with the actual costs. I think that makes sense. I mean, we're on a shoestring budget. We're trying to cut costs wherever we can. So to the extent people can pay for the services they're getting, I think that makes sense.
I would say, just so we know, so next year, if these fees have to come down a little, that's where we come to you and say, hey, our fee was $240, it actually should have been $238. We're gonna come down X dollars, and we offset
It
it.
tries to reflect our actual cost.
Right,
Yeah,
I think
which
that's the
is
big
fair to
emphasis.
everybody.
But we also were looking, like, so Dan and I, not to belabor it, when we looked at it, the number that the ODH spreadsheet kicks out is what you're supposed to be charging to make your ends meet. So instead of being arbitrary, we're gonna raise it 5% this year or 7%, just do that number, because that's the number that their spreadsheet saying that's what it cost you. So why do 5 or 10% when that's the number?
There was abuse of the formula way back when there was not a formula, and they just charged whatever they could. They pay for everything in the health department on the back of the food operations. So that's why we got put into place now. It's a little restrictive admin, but at least it's capped at 30. Keeps us all safe.
Okay.
I'm thinking that we even reduced some of the fees several years ago.
You
I
We
mean, I
did
remember
during,
like,
talked about
we did during
this.
COVID, I think 2 or 3 years in a row, we reduced fees.
Yes. In COVID years, there's, most health departments reduced their food fees for at least 2 years in a row because of that time not being spent in that program.
And also, I mean, and so why Dan and I really don't like the formula, or at least I'm gonna say I don't like the formula. If you have employee A who has family insurance and they leave at the end of the year or middle of the year, and employee B comes in the same position, they take no insurance.
Yeah.
That's a $20,000 reduction in cost, because you have to reduce your prices the equivalent to $20,000.
Or vice versa.
So, or if someone comes in
Yeah.
like nothing and they go to family, like Brian said, I mean, so this is where this thing just just goes up and down, up and
Yeah.
down. There's no consistency for the person who's
That's
paying the
very
fee.
sensitive to those
Yeah.
little changes that
So-
are actually big.
And obviously with a lot of staff right now only staying 3 or 5 years in a lot of places, this is not a 30-year employee anymore for a lot of these things, so.
All right, admin report.
The only thing I'm gonna add is I've asked you a presentation for Jobs and Family Services, just kind of give an update on what the health department is doing. The funnest part was instead of asking questions about COVID or medical stuff, is all about septic systems. So I thought that's a lot more fun to talk about than other stuff. Ron and I attended the Ohio, Association of Ohio Health Commissioners Conference 2 weeks ago, I think is when that was. And we'll talk about the rent, we're gonna talk about the EHV. And then Ron and I are working on our side, but we are able to get a Geauga Public Health credit card through a way with Lake, which we're working on how to get that solidified so you guys can sign off on it so we can do that. Because as of right now, we need to pay a bill and they say, oh, it's a credit card or check. We have to go to the auditor's office, get a check, mail the check. And sometimes that means we don't get the price we wanted because it may come out later. So we're looking at that option. We have some controls in place. So we haven't been at Lake, but this would be different, it's similar but different. So we're working on how to do that so that we can get these things processed for you guys, and plus it'll speed up almost everything we do here to get things a whole lot faster. Because right now your only option, if you said, hey, you have to do this tomorrow, my only real option is I go buy it myself and get reimbursed, which is what happened when the power went out here, or sorry, the cooling unit, the nursing department went down. I went out and spent $500 getting fans, electrical cords, and everything else to blow the air through to keep the refrigerators from overheating. And that's how we fix that. Obviously, I mean, I can do that, but had someone said, hey, I don't have $500, we wouldn't have a way to cool the building, to cool that area down overnight. So, yeah, that's why it's important to be able to have this, so we're not front-loading somebody or having a bunch of reimbursement checks all the time.
Okay, makes sense.
Other than that, we'll talk, I mean, do we want to talk about the rent thing now or later?
Let's talk about that later. Well, I was gonna ask about the Parkman wells, because I thought it was supposed to be finished by the end of August.
Yes, it is, or was.
Okay. Well,
We added 6 or 7 new wells,
Okay.
and we extended that through the end of this month because obviously it's adding a lot of new wells.
So it's
And
still
that's-
considered phase 2.
It's
though,
still considered
of the-
phase 2.
Okay.
We talked to Ohio EPA, they approved it. We're going through that process. The hope is into this month. Obviously, a lot depends on the homeowners contacting them on time, being available. We had some issues finding wells, honestly, the time we went out there with them. One was actually under the deck of the house, and it was like not like a lot of deck. It was like a foot or two above the well. So there's things like that it may change how it gets processed. But we're going through them pretty quick, honestly. And they made the last one in time. It's by August. I think it was August 30th. They finished that one up.
Okay.
So
How many wells have they done so far? Do you know?
7 or 8 in the first one, maybe, and then 7 the second.
Yeah, we're 14 or 15 right
Yeah,
now,
I think we're gonna be close to like 21 when it's done.
Yeah.
Realistically, because we found a couple more south, and I told you guys before, we kind of like an arcing pattern to find where it stopped
Yeah.
at, and we found where it looks like it stops, and that's where we stopped going any further. We got a bunch of negative test results, but I think we're done there, and that would be really close to 21 houses. I think 21 wells, very close. So, yeah, it was interesting. We hoped we were done, and we found a couple more, and then a couple more, and then a couple more. And
Well, that's a lot of people that we were
it was.
able to get.
I mean, the first thing we thought was there was 8 people kind of total, and then it was 16, and now it's almost 21.
No, I mean that's significant. I think.
Right.
So the fact that those people have clean drinking water, job well done.
Is there anybody that said no before they came back and said, oh yes, let's,
We had 1 or 2 that said no, and they've held no, I think.
Yeah, we have more people who are kind of upset that we get negative results on their wells. They want us to come
They
back
want
to
to
recess.
recess.
So
Yeah.
that's where we're at now, is we
Huh,
have
interesting.
a handful of people that, we've tested them twice, and, well, I don't think I had, it was like, well.
Use the wrong water.
Yeah, pretty much, yeah.
Wrong sample.
Yeah, you should use this sink, and it's like, well,
Interesting.
Yeah. We talked to the Ohio EPA, we kind of stopped it too, because it's not free to do the results, and I don't want to be going through pulling hundreds of dollars per house
Yeah.
on results that we've already tested twice as negative.
Yeah.
right,
So, I'm trying to think what the one lady was. She was like a mile away from the site, and she's like, "My well's bad." I'm like, "Not because of this." I'm like,
Yeah.
just being honest here. It's not.
Yeah.
It's not because of this.
Right.
But I think
Maybe.
we still tested her. I think it was fine actually too. She was quite a ways away. So.
all right, thank you.
Do you want to talk about this workload bullet you have in the?
Sure. So right now, we had the HDAC meeting last Wednesday, if I remember correctly, and I was talking to one of the board members that was kind of like, you kind of only tell us the positive stuff. You never tell us when things are like not the greatest. And so, I kind of put the workload, because we talked about the HDAC too when they were asking questions. When we first did a lot of this stuff, there was no expectation of the Parkman wells at that time being what it is now. The rent issue of negotiating that, the plethora of other things that have come up, there was no intention or understanding of all that happening, and it has cost significant time. And most of the we chip in where we can. Dan's been nothing but a great sport, helping a lot of these things, but I would say consistently we're putting in sometimes even double what the contract was for in terms of time. And then we had the issues we had with our investigation with House Bill 110. That was a huge one. That was, I think I told you the one, I mean, that was about, I think it was like 100 hours the first week, it was 110 the next, 120 the week after that. Because the only time that we could have the auditors come in was at night, so they didn't interrupt anybody, and they would stay till 8 o'clock. We'd come in Saturday and Sunday from 8 to 8, or something like that, or 10 to 8, depending on what they could do. And we'd be here, it was almost 3 straight weeks to audit all the records. Now we're looking at operation and maintenance, getting that up and running. That's obviously a significant time suck. We knew that was coming up, but with for sale property ending, we have to ramp up for O&M, operation maintenance, because we've lost our only real revenue source that matters, besides the levy. I mean, that was the only revenue source. So right now, we're down on revenue, to say the least. So we're trying to offset that. Not offset it, but we're getting O&M up and running. We went to Chester the one night, Chester, and they actually forgot we were coming, though we clarified it the same day, and we were out in the parking lot, and they closed the building and left. So we didn't actually get to have that meeting. Thankfully, only the newspaper showed up, Anastasia, and we were able to talk to her and be like, why don't you just come in? We'll just tell you things like in person, because it's a whole lot easier. But nothing against them. They left and forgot. And we were like, all right, now we got scheduled again. We took a different approach, though, because we had very few people actually attend the meetings. So we're sending the letters out instead. And then once probably people who realize they're being affected get upset, honestly, they're going to say, all right, now I got to attend the meeting. And then they'll come in.
Yeah, so we have the room over here reserved October 26th.
I think it's 26, yeah.
And for a few hours, so when people get their initial letter and there's an angry response, hopefully they'll come in for that rather than advertising and having a proactive, because nobody showed up for the proactive meetings.
Right,
Really.
well, they should get feedback, I mean, in the letters, so.
Yeah.
And my thing is, because somebody asked me in the HDAC, why didn't you talk more about that earlier? Some of the things like we're doing, and the reason was, at least from my standpoint, if the person, like if Ron or I or Dan talk negative all the time, like, oh my gosh, we're so stressed, oh my gosh, so much busy.
Yeah.
Then the staff start to absorb that. It tends to be what happens, right? You absorb whatever's around you, and the staff get negative, like, yeah, me too, and then
Poisoning the well, essentially.
right, and we've turned this whole thing around, in my opinion, where we have a lot of people coming. Yeah, right. We've turned most of that around, where even the public comes and talks to Dan and myself. It's mostly very positive. They're like, it's a very positive place. They get me help right away. I'm out of here in no time. They're working around my schedule. We had a lady Dan just did a training out for soil. Well, it was with soil and water, but it was at the library across the road. And a lady was like, well, I don't know how I get you out there, blah, blah, I need this done, I don't know how to switch my D-box to my septic. And Dan and I were like, we have people out there all the time, we'll just send someone to your house as they drive by and show you, tell us what time you're gonna be there. And she was like ecstatic that, we were gonna charge her $500 to come out and tell her something that, she made, I think her husband passed away, so who had done it before, I think she said. So, it's stuff like that is making a positive impact. And the staff are like, if Dan and Adam are willing to go out there and do that at 6 o'clock at night, I'm willing to chip in at 4 o'clock, whatever I can do. And when we ask for help on the weekend, if there's a clinic or the UH needs help with someone we're partnering, the staff are like, oh my gosh. And they're like, oh yeah, I'd love to go help with that. The fair was a prime example. Besides Sunday, that was all volunteer. I didn't have to tell anyone you have to work the fair booth. They all volunteered. And that was phenomenal because it would suck to tell you, hey, listen, you're going to be mandatory overtime. Instead it was, I can't wait to be out there and work it and talk to people. And they gave away 900 or 1,200 some frisbees or whatever it was. They had a blast doing that. It was hilarious. All the little cows went in a heartbeat. But the staff are just, they're excited for what they're doing. And I think I don't want to poison that. I want them to stay excited, where they're excited to show up every day, excited to talk to the public, excited to report what they do.
Which I will say is a huge culture shift from even this time last year in the discussions we were having about, the morale of
We're
staff.
the beginning of the year.
Right, beginning of the year, right. Fairly recently, I should say.
Yeah.
So that's a good shift to hear.
Yeah, I agree. So it's not that I don't want to tell you guys the drains of stuff. I just don't want that to be the focus, so that the staff hear the focus is the negative stuff.
Yeah.
So are you thinking you need an additional employee, or you just kind of have to let some of these fires be put out and see where the dust settles?
So ideally, with O&M coming up really quickly, a secretary of some sort or clerk that Dan and I can use would be the ideal situation, because there's a lot of stuff like Dan and I can't even get to our emails most days, because I think from the time he walks in, he's in meetings with staff or on phone calls. I'm in the same boat, and we don't get the emails half the time. So even someone that we'd be like, hey, we trust, need you to go through these, cauterize the wounds, or tell me if one's an emergency that I have to respond to. But, kind of work out from there.
Do you think that this will improve once the Parkman Mall project is buttoned up? Should you wait and see how, the staff allocation changes once that's done, or do you think that that's an immediate need?
I would hope so, but I think the reality is with a lot of things coming up, including O&M, it's gonna be a need long-term, which
Okay.
O&M will pay for it though, the equivalency they put on there, it's gonna be mostly O&M. But we knew that coming in, I think when we had talked 6-7 months ago, it was that we have to expand the staff for
Yeah.
operation maintenance.
Mm-hmm.
For the mere fact that it's super clerk intensive and super sanitary intensive.
Okay.
So,
So
you
what are
know,
so remind me again, what are the numbers for O&M? Additional people?
so what, two stands and one clerk?
Something in that ballpark.
Yeah, about that. And
Because it's a lot of, what was that? Yeah, so it'll probably be, we probably don't need the 2 sanitarians right away. We
First
probably need
phase.
the 1 clerk sooner than anything else. Because we do have some manpower that we have kind of reserved here for the sampling, when we start that coming up in about a month or so. And then there'll be a little extra sampling for the other sanitarians to pick up also. So kind of gonna try to see if the manpower, we can squeeze it out of the manpower we have now for the get that sampling done to start with, and then without having to really go heavy on adding people.
Okay.
and it's,
Thank you.
and like you've probably seen as we roll out these things too, we get a lot more requests for things too, because Dan and I are willing to go teach things, we're willing to go give presentations, things. Those all have been a huge time suck as well, in a good way, because
Yeah.
we're out in the public, we're
Yeah.
out there seeing us. If you came to the fair, I was there the whole time, Dan was out there, the staff was out there, and it was good because we had a lot of people stop by and like, hey, I heard about this, hey, that, and we were able to answer almost every question they had.
Mm-hmm.
Whereas before, you may have been like, all right, let me get this person, maybe that person, but it went very well. So
Okay, well, keep us updated,
Yeah.
and I think we're probably, well, I don't wanna speak for anyone, but I certainly in favor of additional employee if that's needed.
yeah, I think it is with all the things going on. I mean, we've added a lot of different things, and I think it is warranted. But again, it was stuff we knew ahead of time, like we talked about before. With operation maintenance, we have to expand. That's a program we cannot do with the staff we have. And once we're in full swing, years from now, I mean, we have to review that and see where that lands at, because we just never know how the public's gonna react to certain things. Is Dan in court a lot because they aren't complying? Is he dealing with paperwork because he's had to do mail out?
Yeah.
Is he training somebody new because we have a new staff member? Those are all things that you just can't account for. You hope for the best, but we don't know.
Okay, you wanna move on to financial statements?
Yeah. We have not billed for Lake County yet, so that's why the balances are still pretty high in the accounts, the cash wise. I'll hopefully have that billed relatively soon. One thing we had to do was we had to get the PO open through the county, which we did relatively, not just about a month or two ago. And then 2, we were seeing where things evened out at, because right now, on the EH clerk side, there's 2 clerks that are Geauga public, they're like only job. Before you had 3 or 4. Gina and Marianne from our team have been helping out a lot with those things. Marianne's retiring at the end of October, so we have to replace that position anyways. But she's been helping Dan and myself instrumentally with operation maintenance, HDIS, all these little updates that have to be done. That'd be a huge loss in general, her being done.
You said the end of the year she's retiring?
End of October.
Oh.
Yeah, so very close.
Okay, so you need to get someone,
Yeah, either way, we have to hire for that position.
Yeah.
We've been using that. It honestly saved Geauga a bunch of money because she can do both, and it just didn't cost much. But going forward, we're gonna have to replace that with how it was before with that 3rd clerk, and then the 4th clerk would be if Dan and I have someone that we can have do a lot of the paperwork that's eating up time right now. But any questions about the generic or general financial?
yeah, I had
information?
a question, what Conduit Health and Communities Corporation?
Oh, Conduit is for our
Is that
health
software?
needs assessment. So it's a yearly thing, or sorry, not yearly, every 3 years we have to do that. It's our CHIP and our CHA.
Adam, can you just explain quickly why we have all the negative figures, then we have all the $0? I'm just trying to.
Contract service.
Oh, some of those are, so Sunrise Springs, if we got credits on the account or anything like that, some of those could be for that matter. And
Well,
then.
Just look on, like, page 1 is all these credits, and then you go to page 2 and you start getting zeros.
Right, yeah, I think it was formatted a little differently this month month than it usually is.
Yeah, so
I
what,
mean-
what some of these are, it looks like, is
Maybe
they
then
were,
and nows for
they were
some
the
of
then
them?
and nows, but they were
That's
probably
right.
adjusted from the general fund, some of these are the fund that we paid them through.
Okay.
I can double check that, but most of these are the then and nows.
That's what I thought it was as well.
Yeah, and they may be listed somewhere else, would be.
They are listed somewhere.
Yeah, I
Okay.
think when you
Okay.
have notes.
Oh,
set up
yeah,
for
they
notes,
are,
you'll
they're
see
under
this.
053601,
Yeah,
so,
I was just trying to figure out why,
oh, that's why, because of the cash equity shows up on this one, it should not. That's
Yeah,
why.
That's what I figured you
Okay.
ran the report a little differently.
Yeah,
Alright.
he just probably ran it with the wrong subcode.
and on page 4, the Flannery and Georgialis, I thought we were done with that already.
I think
It's
we just
49,000.
authorized that, so I think that's the check we just authorized.
Yeah, that was the one, so we had the then and nows that we were
Oh,
processing
okay.
through.
All right,
Do we know what our total is for what we've spent on legal costs this year?
I had that, I'd have to run it again though.
We don't wanna pick on attorneys right now.
I'm a little stressed out about some of those numbers I see
Yeah.
coming by every month.
I mean, honestly,
just-
that's, the good, bad, and indifferent is that was mostly the House Bill 110 audit. I mean, that
Yeah.
was, I would guess that's probably, of the bulk that was recent, not before, but of
Yeah.
recent, that was probably 90% of that bulk. And
Just
that was,
reasonable, but.
again, almost, I think 2 or 3 straight weeks, that was almost every night, them coming in with me
Okay.
at night, going through it, and then coming in Saturday and Sunday.
Mhm.
And then Brian's time as well,
I don't
obviously.
think
Yeah.
there's been much time costing Kurt the last 2 months or so. I mean,
Mm-mm.
well, that's fine, I'm looking at this going, okay, it's August.
Yeah.
I mean, I
yeah,
just,
it's like, a good question. Yeah.
All right.
Yeah, it's just our $500 retainer that'll be consistent, but honestly, a lot of that was, the PO wasn't open to the extent back then, when we didn't know how big this was gonna be, and so,
Right.
in hindsight, the PO would've been larger.
Okay. Moving on to the health commissioner's report.
Yeah, I'll try to be brief. I had attempted to send some documents down to the board, they got rejected by the server. There's too many files and to get down there in a large size. So I have my personal notes, I'll just pass this around, I can definitely get more information out. But the accreditation report, if you remember, we got an extension until December of this year. On that report, though, circumstances that you have to disclose are changes in leadership, budget, personnel, governance, program, or significant impact on the health department's ability to conform with accreditation requirements. So from the last report till now,
Very different.
they had to create a special category for Geauga, as we mentioned. So we have to go through like emerging public health issues, innovations, so we gotta go with the Ohio Department of Health. Adam and I had a chance to talk to Dr. Vanderhoff down there, Director of ODH, and he seems to be pretty earnest about pushing money to accredited health districts. So your fee is paid, we'll be in year 2 of 5. We'll try to do the best we can. One of the things is having a full-time accreditation coordinator, which we really don't have on either side right now during the transition, even for Lake County and as well as Geauga. But we don't have anybody assigned to, at least down here. We have one health educator who already is 40 hours paid for, and grant dollars not able to be utilized. It's very hard to do that. I want to just pass this around so you had an idea. I'll meet with the board president, if that's okay, on some of these issues I'm going to cover, and then we'll be well prepared for board discussion. Other than the financial stuff we talked about, we have the extension of the local service collaborative. So Association of Ohio Health Commissioners is our public health organization that works for us. The local public health service collaborative was a nonprofit offshoot of that, which is basically a clearinghouse for billing. Prior to the pandemic, the Board of Health here in Geauga authorized $12,000 to buy into the eClinical software, which allowed you to bill under that umbrella clearinghouse. Vaccines, nothing happened. You never got onboarded. So one of the things we need to discuss is that value. Where do you want to go with it? Do you want to spend $12,000 to sign up for that, to give vaccinations, or run it through Lake County, but somehow figure out how to keep this funding separate? So
I
we
think
really
this
gotta
might
look
be
at that.
time that we revisit the discussion when Dr. Rude and I were discussing about, we have all of our health systems on Epic, or at least in 2 days we
Yes.
will, and the communicability of the information if we were to adopt that software versus how can we work with those organizations to see if we can piggyback onto Epic.
Yeah,
So
that was
everything
we're having
talks.
this discussion,
Yeah.
if we do additional physician recruitment, but all hospitals are doing Epic, because that centers on the United Us platform, which is a community-based referral system, which can track. So we really, probably want to have the discussion, we get the money back,
Yeah.
or, under a different umbrella.
Okay.
I think Emily, your health educator here, will be met with the UH hospital, where I'm
Okay,
meeting with
that was
Vicky, and
Today.
have some
Yeah.
discussions on that. community health assessment and where they're headed with that as part of that project.
And when Ron mentioned the accreditation coordinator position, that
Mhm.
was one we knew we needed.
Yeah.
We didn't have someone at that time doing specifically that, so it wasn't in the contract, given that we didn't have it. We were
Mhm.
trying to figure out how the accreditation could flow underneath Lake.
Okay.
So Ron's working on that. That's why that position is not currently filled, is we didn't have enough time. We said we'd wait and see what happened with the contract.
Yeah.
Yeah, and in regards to, I think, the state, and just ethically and transparent, we're trying to work with our prosecutor to come up with some language about how we handle communications from the state, so that if Ohio Department of Health contacts me or Adam, we're Lake County contractor, we're also, we're down here. I'd like to say it as one, but they still draw the line that they wanna make sure the board and Geauga's residents are getting that information directly, so probably we'll have a resolution we could add to that also include how to handle the invoicing. Probably maybe would recommend a third-party invoicer at our cost and look at those documents to make sure they're secure. Anything over $500 should be signed by the Board of Health President. Just some of those safeguards, so as soon as we get that, that'll be presented to you, but we felt obligated to write that up since we own the contract, and then certainly get it to your legal, just to make sure everybody stays clean. This is you pass it down to Board President, but that's just the information from the Local Service Collaborative. We'll discuss that. Pertussis is down, quite a few vaccinations given out. That's not really considered an outbreak now. Really never left the Amish community, a few cases, I think under 10. So that was well done with DDC's support and the board utilizing staff rather than just dollars to throw at that problem. So I think all is well on the landscape. We did talk about the district advisory, looking at potentially doing a newsletter to the community, to help them understand the details, the actions, and 2 pages, 4 pages, whatever. If the board agrees that that's a decent idea, Adam and I will work on that and get some of that information out, document our success together. If you have ideas of anything you would like in there,
How often would that go out?
I think just quarterly.
Yeah, I think that makes sense.
Yeah,
There's
especially
only
given
so
the
much
burden
we
on
can work
staff.
I just wanted to make sure it wasn't like
Monthly,
or
minutes.
weekly,
Yeah.
or, yeah, like,
I mean,
calm down, guys.
Tuesday.
Yeah, alright.
So just 2 very, very quick questions for points of clarification. The first was 4.04.03. We are still offering Project Dawn even with the over-the-counter Narcan rollout, correct?
We haven't changed it yet because we have funding for it, so
Okay,
yes.
yeah, so I was gonna say, we don't know what the over-the-counter cost is going to be for people, so if they can obtain it free through venues such as this,
Yeah, so
I
we continue.
recommend that we still
Yeah,
have
we
that
usually talk to,
available.
that was a big point at the fair. If someone
Yeah.
asked me how many they can come in the health department, we didn't take it out there because obviously it's just too hard to control
Yeah.
and leave it out there. But yeah,
Yeah,
make it available.
I've
Yeah,
tried
maybe
that before.
updated since then, I think they're thinking the cost is over $40.
Yeah, they said they were
I
trying
was
to
saying
keep it under
48.
50 to
Yeah.
somewhere in there, but the
That's
problem
about
is,
right.
I mean, you have people trying to go in, and if they
Yeah.
can't afford food and,
Mhm.
basic needs, then they're certainly not
expensive.
going to pay for this, since you can't bill it through insurance. There's
Yeah.
other venues, and then Project Dawn is free, so.
Yeah, something may help us with, we're actually looking at, Adam will speak about this too, but the medications for students through the school system, and like
Mhm.
Geauga is antiquated at best, just,
Yeah.
cabinet kind of thing. So we did talk to Tony Joel, who's like lobbyist for schools, looking at
Yeah.
what costs we can get some of that equipment
Okay.
for both counties. So
Yeah,
we
loop me in. I'd
pick your
certainly
brain on
love
what
to
kind of
help.
information,
Yeah.
machines or dispensing meds with
Yeah.
protocols we could help you out with.
Yeah,
help us out.
absolutely, I'd love to do that, so just let me know. The second kind of question I had
Yeah.
was about 4.0 to 4.05. Does this change anything when we talk about you as a designee for the commissioner? Like, I was reading something about the bond and insurance, can you kind of explain,
Yeah, that's,
Yeah.
that was
does that
pretty
affect
much.
anything?
I'm not equipped enough to know exactly what, if we have a problem or not, but so it's over at legal's hands as well.
Okay.
Because I think it could leave us exposed with our current structure, because I know for
Okay.
us, we had to name a couple designees on my behalf, which is I think Dan and Adam.
Yeah,
And
that's,
if we don't have coverage, we don't have coverage, so I just send that to our legal and
Okay.
we'll leave that to your legal, make sure we're
I
covered.
just
on
wanted to
that.
make sure I was understanding that
Yeah, it seems like we
correctly.
could be a little exposed, so
Okay.
those that are my designee are exposed.
Okay, thank you.
Can you address the grief and public health? I was kind of,
Yeah, so that was information just so it's out there, but the state was really concerned. We did have a kind of a debriefing as a program in place with health departments. We don't really have a robust wellness programs. We have some ancillary services where we have their insurance, like e-nurse kind of things. So they just want to made it available to everybody with videos or consulting, so it's just kind of a good faith kind of effort. I don't know that.
Like an employee
Much is
wellness plan
utilized.
or so? Or is
Yeah,
it
you
actual
both-
grief? That's why I was,
I'm not sure the exact details.
I was surprised
Did that
with
go
this
through it?
going, are we talking, what are we talking?
Like coping with things that they see versus like
Yeah,
employee wellness.
pretty general, just coping with what was, whatever experience or trauma they had during the COVID epidemic.
Oh,
either
so
Okay.
specific to COVID. That's why I was trying to wonder. I said,
All
what
right.
are we coping with? Is
Yeah.
how I was trying to sensitively ask that question.
Yes, PSD.
Got it.
All right, so goes
Perfect.
back to
Thank you.
COVID, okay, I was like.
Yeah, yep, sorry about that.
I was
No,
like
that's
going,
okay. I
are we
didn't know if
dealing
they
with
were
people who
seeing deaths
die, are we
or-
doing,
yeah.
are we doing, is this narcotics related? I was,
Right.
thank you.
Yeah, no, yeah, I should clarify, sorry about that.
Okay. Moving to committee reports, committees, no committees, so go past that one. Old business, I guess rent, is that old business?
Sure.
You wanna talk about the rent?
All right, I would ask you to avert your eyes, or look your eyes, I guess, not
I was like, I have to
avert.
go that way?
To, it's been a long day already.
Yeah, I'm
Yeah.
missing.
To the screen behind you. So,
Okay.
I'm gonna go through all this. I know I sent out ahead of time so they get a chance to look at it. So the blue line area that's in the square, that's the current space we have right now. The space right here, more or less, was the space we were supposed to have. We gave it to ADP because the county did not have space for IT in the building when we moved in. So we said we could make do with about 3 less desks and 1 less office, and we did that. That one's actually a conference room. It's actually right there. So that's the space we were already down when they did some of the calculations. The green area is if when we were first talking, we had said, hey, like let's get down to like $15,000 or $20,000 tops in rent. Like that was kind of the vibe I was getting from the board, was like that's a high number already. At $8 a square foot, that's about where I could get down to. That would be about $20,000 a year. Roughly is what the
That's
expectation was.
assuming, but that's assuming $8, okay.
Assuming $8, yeah, that was the original number.
Just to be clear.
Just to be clear,
No
yes.
one has agreed to $8.
Yes, no one's agreed to it.
Nobody's agreed, and
So with that space, the right here is our med lab. So that's not space that you can use to sit really. That's just the med lab. These two areas right here are the where we, let me get it to focus so it looks better. Those two areas, our offices are just where we do exams usually. We do vaccinations. We don't do exams, like the vaccinations. Those are the two kind of clinical areas.
Okay.
This is a bathroom, and then this is the big clerical bullpen that's up front. The area back here is 4 cubes. So there's really 3, and there's kind of half. We kind of had them put an extra one where we could fit one. But where that wall would likely shoot out, if they made that our new space, there would only be about 3 cubes there, because the one is like half in the area, half not. This would leave us with roughly, if you take vital stats out, because those two have to be in the office at all times, it would leave us with roughly 9 to 10 cubes total. That's for all the staff that remain. There are 8 sanitarians by 7 sanitarians, right? There's 5, 6, 7. Yeah, 7.
Plumbing.
So, and then plumbing. So there's 7 sanitarians and 1 plumber alone. Now 2 of them do sit up here. So they're already up there plus the plumber. But back in this area, oops, gotta move this whole thing. Right, it tries to make it a little better. That right there is where 5 sanitarians sit, and there's 1 desk for the sanitarian we expect to hire for O&M, operation maintenance, to help assist with that. If we were down that area, that's 5 to 6 people right there we have to displace somewhere else. When you look at these offices in there, 6 out of those 8 are generally filled on any given day, based on supervisors being here and then staff and some other things. There's about 6 of those that are filled. So right there's 12 people roughly you have to displace somewhere else. Dan and myself are in kind of in that area, and then we have when someone does the minutes for you guys like that, because they have to listen to the recording, they're in that office. Now they could be with me, it's not a big deal, but it gives you the scope. When we first talked last time, we're talking about displacing a large number of people. The board would have to be okay with hybrid work models of like home to job site and back home, maybe land in the office 2 days a week for sanitarians. The health educator, I figured that one out. The epidemiologist, the nurse who's here, I mean, she's at DDC a lot and out. We could maybe have her in the med room. It's not ideal because it's gonna get cold in there. There's options we can do, but that green area would be, worst case scenario, you guys tell me, listen, I want to be at this, can I fit us in there? As long as you're okay with a lot of changes, really fast changes too. I mean, we have to make this change quick.
Where's your office on that, Adam?
My office is currently.
No, well, I
Oh.
mean, if you're green space.
I would not have an office.
Okay.
So, because if we use this area, which is the only area that you could make an office, you'd likely eliminate 2 to 3 of the cubes. There'd probably be no cubes left, honestly, because it's not a super long space. It's kind of thin, but you would, in essence, to make an office, you eliminate probably everything that's there.
So would be your only option.
My only option, yeah.
And then
But-
you're getting rid of 3 cubes, so then you'd be down to
We'd be
what,
down to
8?
literally 6 cubes that aren't vital stats.
Okay, 6
and-
cubes plus vitals.
And honestly, one of them, the one that kind of on this map, we don't show the cubes, but there's a cube kind of right there. There's a giant power cord unit that kind of runs out of that floor where it makes me nervous if someone decides they're just gonna lean their foot up against it long enough, are you gonna do damage to it? And that's why we really have nobody sitting there right now, is because it's just a really bad location. And this thing right here is a structural beam that was not in the original drawings that we had, so we were gonna have one additional cube. We can't put a cube there, it's a giant structural beam, so we can't put a cube there.
Okay.
So, I'm not saying we couldn't try to do something else, but, some of the questions that you guys had sent to me or asked me, we would have to condense considerably,
Yeah.
and you'd have to be okay with a lot of people being out of the office a lot of the time. Not impossible, but it's to the point that you'd have to be really comfortable with that. And if someone has to come in, or if you guys decide you don't want to do it tomorrow, that's still the space we're left with, and I can't fit 20 people in that space.
Yeah,
I'm not just
I-
thinking now, I'm sorry, go ahead.
Oh, no, go ahead,
I was
please.
thinking now, the Department of Operations Center, so during an emergency, you need a huddle place, that would not leave
You
you
don't have a
anywhere
huddle
during
place.
exercises, for the nuclear power plant, for outbreaks, any
Yeah,
of those
any
requirements.
disaster planning.
Yeah, exactly, and then I think there's even a breastfeeding room they need, I haven't seen one around
You probably
the
need
agency,
that,
but
yeah.
I think,
I don't know if
I
the
think
county has
legally-
one.
yeah, they need to get one,
Need
but,
one, yeah.
that's a room they're gonna lose again, and they don't even know about, I guess.
So I am a proponent of hybrid work. However, I don't love cutting the staff that much because the questions I truly have, if you cut this many, I should not say that, please let me reword, is if we relocate them, in terms of their daily workspace.
Good catch.
Can't wait for the quote in the Maple
I
Leafs.
I know. So if we are switching over to a hybrid model with the staff that we have, the questions that I would ask kind of rhetorically are, how would this really affect the workflow? Would this cause delays if they're not in the office due to, the fact that their flexibility does change if they, have to be in the field these days, they can only schedule inspections on those days in the field versus in the office so they can get that work done. I think that does kind of cause us to have to change our perspective to focus on the public to say this may really decrease the flexibility that we have to make sure we're interacting with people and meeting their needs.
And Dan and I, just to be
So-
upfront with that, so, obviously I'm relaying the information from the county commissioner side of things,
Yeah.
the county administrator. Dan and I looked at this a lot, and we spent a good part of a day this week looking at it. It's gonna be tough. I mean, now granted,
Yeah,
the
that's-
square footage price has come down in a recent discussion, which I'll go through that as well. But if we took that space, which was the original discussion, to get down to a dollar amount that was semi-doable,
Mm-hmm.
I mean, it would probably take weeks for Dan and I to plan this out and make sure we have processes in place and the controls, and it's.
And there's gonna be growing pains certainly, and is that a good idea considering we have O&M ramping up, we have the parking walls, we're already kind of talking about staff being, a little,
Right.
short. So I have concerns with that. I mean, if we were, saying, okay, we'll give up a couple of those spaces, I think that's a completely different discussion. But I guess my question for you guys is, what ideally would you like to see then?
Well, so the purple area, which is here,
Mm-hmm.
the top purple area, it says 237 or 237 square feet and 321 square feet. That is our lunchroom. No one really uses it as a lunchroom because it's a super awkward space. that goes to the restrooms, and obviously nobody really, if somebody's had a bad restroom day, like stomach day, no one will see them walking back and forth.
Yeah.
So
A bad restroom.
it's really,
Bad idea.
it's really not used by anybody. The one below it, the little tiny square, that's 133 square feet, that is storage unit. It's a little storage closet that we use. Now, it's not stuff can be put downstairs. My goal was to get the when it was $8 a square foot, could I work the way down the price list? That would get us down to about $50,000 total. By doing that was a thought. So it's bring it down by $8,000 roughly is what they expected. We don't use those two spaces. Well, sorry, we don't use the lunchroom, and I really wouldn't be opposed to losing that because I think it's a waste of money for us to
You
buy
don't
that
have
space.
to have.
No, we have a lunchroom right across the
Okay,
hall
yeah, as long
that
as there's one
everyone
in the
uses.
building.
And the bathrooms are redundant, you know.
Yeah, I mean, that's
Yeah,
what, I don't
so it's-
understand the plan when it comes to the bathrooms. So I
Yeah.
guess I'm confused by this because it says ADP space needs. So you're highlighting this area saying we could recycle that somehow, but how does, I'm confused. Why is that purple saying ADP
So
space needs?
ADP had automatic data processing board,
Yeah,
the IT
yeah,
people. They need where they're at. They need some additional people. They're trying to move them off the squares because it's the place.
So they're fighting for that as well?
Well, when we had
essentially?
talked to them, I said because that's if we need to lose some space and cut some money, and they need some space. I said, what do you need?
Okay.
And they said that space, equivalency size-wise, would be ideal for them. They would love it.
And they'll have it restructured however.
Yeah,
it needs
there's-
to be
like
restructured.
There have to be some
Okay,
structural
okay,
changes,
so
I'm
that's,
sure.
that space we still technically could recycle and put them elsewhere.
Correct.
Okay,
yeah.
that's why I was
So
confused.
there's no staff in that space at all.
Right.
Which is why I say if we move the storage location downstairs, we get rid of some of the stuff we don't need, or condense it or make it more efficient. It's not a loss to the agency, so GPH isn't losing anything. The most recent request, which will probably be a discussion on October 4th when the county administrator and his deputy come in, was this space down here in yellow. So they came up and said, ideally, that's the space we want. So that's currently my office and the
I'm sorry.
and the cube, and the environmental health cube farm. That one, you know, they're getting down to a price we wanted, and I said I would go take this to you guys and let you see what it looks like, because obviously that's my job to show it to you, because you guys can sign the contract. The hard part Dan and I still ran into was how do you relocate
The people.
5 to 6
Into there.
people and then
Right.
expanding with O&M.
Right.
I'm not saying anything's impossible, but I still go back to if you said, hey, Adam, you've got to pick one option where you have to give up something because ADP needs some space or because the county or price, whatever, I would go back to the purple area and say, that's the space I don't really see a loss for us. I think it's a
Yeah.
gain for us because we're not paying for things you don't want.
Yeah.
Win-win.
If we did the yellow, right, so if we did the yellow, my first thought was we'd have to take this space down here, two of those 3 offices,
Yeah.
and knock a wall down and make it, because my office serves as the conference room, because it's the only
Right.
conference room table. So generally, if Dan needs a meeting, or I need a meeting, or we're meeting together, that's where we meet at. Then we can close the door, have a discussion, and talk. Or if we need to pull staff in on stuff, it's quiet enough, it's not disrupting the whole office. If we lose my office, the only conference room we really technically have, which is it's quasi an office, is that space. It's not large. I mean, we fit maybe 6 people in there tops, and you're tight at 6 people.
Yeah,
You're
it's
tight.
squished.
Right.
So I'm not sure how we would have, you know,
I was
9
trying
staff.
to think of like traffic patterns too, like if ADP needed an area, let's say you gave them the yellow, are they walking through your department to get to the other side of the
So-
department?
Walls and doors would have to be put up.
Right,
Yeah,
yeah,
so-
so that,
Walls and doors would have to be put up.
ironically, there's a door right here. That door has a security bar on it. That there's a giant sign that says "push for 15 seconds" and you can walk in.
Can't access it.
It's an emergency exit.
Yeah.
We had a lady who literally read it, did it, and then walked through our space. And then the question came up, and I had the same question: security-wise, my staff cannot be. There's no security for my staff at all.
yeah,
So if something happens, God forbid, I have no way to secure my staff. So right now that has changed, we're just locked, and we're working through the process. The county would ideally, realistically, they'll have to put in these doors here that are on there, and then another door somewhere like right there. So there'd need to be 2 doors, because this is the stairwell that the exit is. So there needs to be one here and one here, or some equivalency. That our staff, they can't get into that area because there's no reason. That's not your secondary
Yeah.
exit. Your exit is upstairs. And again, my concern is just if anything happens, and plus I'm trained new staff. What do I tell them when they say so? If something happens, what do I do? And I go, honestly, there's no security because all your office doors are glass that they can see through. Everything else is glass they can see through. And technically all they gotta do is push the door and then get in.
Yeah, that's not great to have that sign on.
No.
But
So it was, we made a decision at the time to do what we could. It's not a permanent fix because it has to be changed back. But my main concern was, had that lady have walked through and had there been HIPAA stuff out,
Yeah.
and had she decided, we didn't catch her in time, we caught her in time, had she have started grabbing stuff,
Right.
what would we have done?
Yeah, so I guess that's my concern is
So-
traffic pattern wise and how we
Well,
can keep our,
As far as I'm concerned, the pattern's not great. I mean, if you think about coming in to see the clerk up front, that's it. It's a long walk back through the cubicles to get to that back wall. It's direct, but it's a long way back. And people could get lost, but people shouldn't be back there. I'm just gonna go on the record, I am not totally in favor of hybrid model. Because I think employees need to be held accountable, but for them to be held accountable, they have to have space to be able to show up in. There has to be a way to hold them accountable. If you're out in the field all the time, what do we do?
And I
Do
did
we do
that.
something to connect them with long wires or,
You
their
have to
mobile
have a
phones
way
and stuff?
to-
I mean, the point is that we have to be able to, because how do we answer to the public is, oh, you've got 10 employees and they're out on there in the run. And they don't have, we can't.
you'd have to have a way to audit the work.
I will tell you also, we came here, we had no rent, ever, that any of us is aware of. Okay, there may be people before me, but there was no rent. We came here, we asked about rent, and we never got an answer. Okay, I understand they maybe hadn't figured it all out, but we had not got an answer. $8 doesn't sound like a lot, multiplied by roughly, if we keep the space we want, probably about 6,500 square feet. That's a big. Give it to me for $1 a square foot.
I like your numbers.
I mean, the point is we didn't have to pay anything before.
It's a
Why are
big
we
jump.
paying now?
Right.
The
Yeah, what was
taxpayers have paid for this
Right.
building.
Were
Why
we
are
given
we?
an explanation for why now?
I mean, like I mentioned before, they'd always talked about being some rent number. I mean, when I think rent number, I was thinking some nominal fee of like,
Buck an hour,
You know,
I mean,
yeah.
$1 a foot.
for $5,000 a year, you get to stay here and, you
Utilities.
have the
Yeah.
space.
Yeah. Right, just,
They need to answer why they want all this money. But also, can you just point out the obvious, what spaces are occupied now by us?
The only
Can you highlight
spaces,
Everything
the only
blue.
spaces
in
not
the blue.
occupied right now, on a consistent basis.
No, the space is occupied by the Board of Health right now.
the blue outline encompasses.
Yeah, the whole, anything blue.
Everything in blue.
Yeah,
Again.
that is currently our space.
Right.
Yes, and we don't use this.
And how many square feet is that?
They had said 7,200, but they think that included that ADP space.
Right.
So they're gonna redo it.
Right.
Let's say 6,500 for round numbers. I have to go back and calculate all of it because obviously
Yeah.
my main frustration has been more of how do I find what we can fit in more than what the cost is.
And what is the county planning to use your space for?
My understanding is IT. So the IT would be in both yellow spaces.
Just equipment?
I think personnel as well.
But keep in mind, when we were planning for this building, IT was not initially in here.
They forgot.
Okay, nobody planned for it, so we graciously gave up the back space. It worked, okay, we gave up the back spaces here, right now. But now they're coming back saying that they need to give IT more. Well, you're gonna give IT more, but you're gonna make the public health department
Why?
work out of their cars?
Right. Why does IT need more space?
Because they're hiring more people
Well,
too.
information technology sounds like something that would be more fitting to consider different models, at least in my opinion.
Yeah, I don't know.
Yeah, I'm just speculating, of course, but I think, what I essentially think I would like to see is, I know we have all of these like Plan A, Plan B kind of things, but do we have models that we can bring to this meeting with the administrator to say, this is what's reasonable, and that's,
And I
the less
think-
preferred, that's,
Yeah, and I think, at least from gathering, the few that reached out to me ahead of time, a couple comments tonight, I mean, it sounds like if we're saying maybe hybrid, but they need somewhere to land, I need all the space we have except for
yeah,
purple.
I don't think
Yeah.
what
I mean, if
we
you're saying-
propose, taking all of those away, is reasonable to even talk about a hybrid model. That's not
Yeah, I
reasonable.
feel like those are almost two separate conversations, like if
Okay.
you're gonna let employees be hybrid and what we're doing as far as paying for
Yeah,
rent.
I think we need to assume we have space to accommodate, and to Ron's point, you need space to huddle, to have disaster planning. There's things you cannot eliminate.
And that's, and
Yeah, I think that's a good
so to go with them on October 4th, I mean, the space, I think that if we wanted to cut some of our numbers down, that purple space makes sense, like, that's not a true loss to the health
I
department.
agree.
Beyond that, when we say remote or hybrid, if we're saying that, we're saying you still need a desk
Right.
to sit at, and it can't be like this shared desk for 5 people,
Right,
then I need that entire space.
yeah.
Yeah, I think it's clear, I mean, through our experience, you know, collectively, through pandemic, is, you know, we've had floods and fires, and we've moved buildings, and we've moved WIC clinics, and we have, you know, 20 times probably in our young careers. You know, if we can make it work, we'll make it work, but there's some things you just can't, without, you know, you can't give
Right.
up, and I think that's kind of part of where this is at right now.
Yeah, and I would hate for us to give up that space and then try and grow, as we are trying to do, and then have nowhere to put these people, and that's what I foresee happening to us if we knock all that out,
And I told
because then we're stuck.
the team who came to me, I said, you know, if the board said they can do remote, and that is like legitimately remote,
Yeah.
then the yellow may work.
But I
If-
agree with
if that
Carol, we
was
can't
the-
make that decision now until, you know,
Right.
the,
And that was
that's so far off.
And that was
I
those
think.
that reached out to me. Were in this, I think you were all in the same boat. Was they still need somewhere to land.
Yeah, the idea is great, but that's not
I
feasible
would,
at
I
all.
would minimize giving them, try to minimize lost space.
Mhm. And that the only one that makes sense is really kind of that purple,
Yeah.
just because it's a giant lunchroom that besides heating up some food nobody uses. And my thought was we
Microwave
would.
elsewhere.
And my thought was we move it over into one of those
Former
the
examiners.
exam room that we call it exam rooms.
Yeah.
Because there's already a faucet in there. There's already a sink. We could put the refrigerator stuff in there. I'm fine with that.
Yeah.
And we don't need 2 of them. One's fine, so we can get by with that.
So what sort of justification has the commissioner's office provided for that $8 a square foot number?
They had a private sector location they looked at that they said, you know, what would it cost if we rented this out, and that cost to them was $8 a square foot. So they used that as their justification for $8 a square foot.
Isn't it necessary to look at public sector though? Because
Well,
it's a
that was
different
my
ballgame.
first thing. Was I said we do a lot of we have a lot of WIC clinics in Lake.
Yeah.
We never pay market. So the market's $8. I'm not paying $8. I may pay 6 or 4. I'm not paying 8.
That's one big thing we've learned is this is very different from
Yeah.
private sector.
And,
So
and we're the tenant that honestly you don't have to worry about. I mean, we're gonna pay our bill. We have to,
yeah.
and we're gonna be here probably forever unless we change locations of some nature. But no
We
one
don't
wants
want
to do that
And
because you
we've
have to
already
change
talked about this is good for
everything.
the Amish community too. The
Right.
location makes
Anchor
sense.
agency.
Right.
Well-
And
And what other groups here that aren't county associated pay rent,
so I asked that question with Lynn.
and you didn't get an answer?
I actually did. A couple of them shocked me. One of them was veterans. They're going to charge them, which really,
Veterans?
yeah, that really, I didn't expect that answer. From a PR perspective, not the best. There were Soil and Water is paying. I found out what their number is per quarter. They're paying quarterly. I don't know what their square footage is though. I don't off the top of my head. And
So they're already paying. Soil and
they're
water.
going to be. I think.
They're
Yeah,
going
I
to
think they're
be.
going to be.
Quarterly.
BMV pays right now.
BMV's paying. They're paying a premium, honestly.
Yeah, but
But they
Number we were
operate
told.
with revenue.
That's different.
totally
Yeah, they're
different.
private sector,
Yeah.
and then the title's paying, but they're a little bit separate. She's voted in, so she's a different hiring authority.
But we don't even have a contract. I mean, we're still talking about space and numbers, and
Yeah, we don't.
you don't have the whole picture, so I even hesitate to go too far until that. It's like,
Yeah.
yes, you
I
got a
don't
little
think-
bit.
I think, I'm really stuck on the fact that we paid no rent,
Mhm.
okay? And how do you throw us into a building and now tell us
Yeah,
$8 a square foot? I, as the taxpayer, wanna know, what am I already paying for this, okay? But I understand that the world has changed and there has to be. I think being accountable for perhaps utilities and those kinds of things makes sense, because some areas are gonna use more utilities than others. If we can do that, we can do that. But I gotta tell you, to go from nothing and being told we had to move here, okay, we were told we had to move here, to now being told, well, now you're gonna pay too. I don't know,
And I think when Lynn and I talked to him, so my main concern, so it was 2 things. One is the taxpayers already paid for it, which they had
Right,
an
that's
answer
what
that
I'm
wasn't the
stuck on,
greatest
yeah.
for, but taxpayers paid for it, which it rubs me the wrong way that you're gonna charge me, which is more taxpayer money to pay. Now, I did tell them, and, Lynn was there for, I said, I have no problem paying the variable cost, which is like your
Yeah,
rent,
your overhead, your
like they'll call them
maintenance,
CAMs,
like,
essentially your
yes,
maintenance.
Yes.
I have no problem paying the rent the utilities
Yeah.
and the cleaning costs. If we weren't here, the cleaning wouldn't exist, it would, but technically it wouldn't. And then the utilities may be significantly lower if no one was in here flushing the toilet or using the HVAC or whatever. Beyond that, I have a hard time.
Yeah, I mean, the commissioner's office should not be in the business of making money off of rent of other county agencies.
That was
Well-
my question: is what is really, where is this going, and like, where's this money?
Yeah,
all
like,
going
what are
into?
they out?
There has to be a
And-
financial report on this somewhere. in
Well,
the
I
county.
mean,
I don't-
to my understanding, it would go. I mean, I don't know where else you put besides the general fund. Once
Fund.
they create a new fund for it, once in the general fund, there's not like tracking for what it goes to because it's general fund.
So,
Well-
and that's, I guess, the question when it comes to justification is what we're operating on. We're trying to cover our costs, and is that dollar figure that they've proposed, is that to cover costs or is that revenue generating?
Right.
And that's my concern.
And like when Lynn and I talked to him, I mean, the other problem I have with it is we've done our best to reduce any costs we have to where
That's
we
right.
just meet our costs.
That's right.
Dan and I have lowered some costs, we've adjusted other ones. Now we're raising the food one to cover that cost, but in general, we brought things down that we couldn't justify. If a fee's $100 and Dan and I do our best numbers, it's 60. We don't charge 100, we charge 60, and so we don't have rent cover these costs. We honestly have to go back to the drawing board and increase all the costs by the rent number,
Right.
which again comes back to Susie or John Homemaker is paying for the building they already paid for with their other money.
And the other question begs is we talk about, we are trying to save money, we've done a lot of things to do so, and we
Right.
have our fund. That fund is going to go away if we have a dollar figure like this that
Right.
we have to pay overtime, and then in 10 years, what do we do with that's gone?
I mean,
We're not
It's
going
not
to.
even
Well,
gonna be 10
well,
years
right,
though.
it's
not gonna be
Yeah.
10.
4
I mean,
years maybe.
I jokingly
yeah.
say it, but I mean, this place will give you ulcers because we look at House Bill 110 is $1 million out the door.
Right.
We look at O&M right now. There's no for sale property money coming in. O&M is trying to ramp up. And nothing against anybody else. I mean, I do believe, like Dan, Ron, and myself, we do kill ourselves sometimes to try to make sure everything is covered and the costs are met, and we give up our own personal time to do that. So it's frustrating when this stuff comes in. It's like, we're over here working as much as we can to reduce because we don't get paid overtime, so we're reducing the cost by working it so staff aren't, and then we hit something like this, and it's just
disheartening.
it's just frustrating.
Yeah.
Is
I just-
anybody else, I'm so sorry, go ahead.
I just need to understand why they believe we should be paying rent when all the years we didn't. Give me a good answer to why I should pay rent now, and I
Yeah.
haven't paid rent before.
And October 4th, that's next Wednesday.
Next
That's our next meeting. I have invited Jerry Morgan, the county administrator, and Linda Berhenny, she's a deputy, in to talk. So as I told them, every time we've talked about this, I can't commit to any of this. I can't say yes to purple, I can't say yes to yellow, I can't say yes to green. The board is the one that can do that. I can communicate these things to you, but I said, I told them, I said, I don't know what the board's thinking about hybrid remote schedules. That's the thing, I can't account for 5
initially,
people's minds
yeah.
and how they view that.
And here's
Was a
what we
good
also
idea.
have to realize, this is a new building. And as buildings age, give this building 10 years, you're gonna start having repair costs and additional costs. Now, right now, we already have an issue that I don't know if people recall, but there is no backup generator.
Sorry, there's a backup generator. The HVAC is not tied into
Oh, the
it.
HVAC is not tied into it.
Yeah.
Well,
Okay.
to your point though, rent is only going to go up.
Well, that was a concern. I did voice that thing when Lynn and I met with them is if it's, I'm using 50,000 round number. If it's 50,000 this year, is it 55 the next, 70 the next,
Yeah,
100 the
we
next?
don't know, right?
I don't know. And that's something that variable costs terrify me because they're variable costs. I don't know I can't plan, I can't account for it.
And as a building grows old, I'm sorry, it does age, and we will have additional bills that will come to this building. The county will pay, but that just gets passed down.
And
We have to be very careful right now.
The HVAC, as I mentioned to some of you when one of you stopped and we talked, is when you look at the HVAC system in general, if it's not tied to the backup generator and the power goes out, which it did when we had this tornado obviously, but it still went out, the staff worked, but I was actually not in the building that day. Dan was here, it was very hot, very muggy. We probably would normally send them home and say, hey, it's within OSHA specs are what we use. If you're within OSHA, you can be here. If not, it's a liability issue. So we would send them home. That's on our dime. I mean, well, sorry, you're dying because we're sending them home because they can't be at the building that is supposed to
Yeah.
be here available.
Adam, what is the backup for the, our meds room?
So that is on, so
That,
as weird as it
I
sounds,
can't remember.
the entire building except for the HVAC, and then I did ask if I haven't heard yet back, if the sidewalks, they're heated, if that's part of it,
Yes.
because it's water being pushed, I think it's HVAC, it's probably not like electrical.
Boiler,
Yeah.
If those aren't, everything else is tied in but those two things, which is a
Those
very
two.
strange thing to not tie in because you can't be here if the HVAC isn't working. It's 100 degrees in here or
Yeah.
10 degrees. But the other biggest concern I have is what happens to the pipes?
yeah. And
Because they don't have faucets here where you turn them and they just drip. They're hand sensors. So if it's frozen, what
That's a
happens?
problem.
Yeah, so
Yeah.
as far as the med backup, we use both health districts and have for years, and in the hospitals, like the third tier backup, and fourth is, another building we have security over, or if could be taken.
Yeah, I just can't remember. I
Yeah.
know I helped us. I was part of a lot of this. I can't remember what we did with the med room, but I know we had to have some backup. In
We
there.
have like the red plugs, like
Yeah.
they're on a specific plug for
Yeah.
backup, but yeah, you can't have excursions for, the
Exactly.
vaccinations
So-
and things, you'd have to throw them all
We only
on
get like
fixed
minutes
seeds.
with an excursion. And then
Well,
we're-
it depends, or you have to use it
Yeah.
in X amount of days and then you throw it
Yeah.
out, right?
Yeah,
So,
exactly, so
anyways,
we have emergency plans to move the product.
yeah,
But
so.
I think for me, as hard as we traded good staff to keep everybody afloat, and find out what we need to do to the public to get the money back. $60,000 in rent is tough, but when you look at what that was impacting the staff, that's the hardest thing we have, is that we've traded capacity, we've created, security and planning and cut staff to get savings, and it's hard to go back, we don't need to, without,
So the that area is not covered by the generator?
the HVAC in the entire building is not covered by the generator.
And so with the commercial refrigerator we have, it generates enough heat without an HVAC, you might as well say you don't have a fridge or a freezer, because
Yeah.
it's not
Yeah,
gonna
that's-
keep up.
And that was, I think I talked to you guys last
That's
month, or
amazing.
that's why I went to Home Depot that night after the fair, and got the fans, was because the temps reading was so high, the alarm company was calling myself saying, hey, you're gonna have an issue here, so
Yeah.
I went to Home Depot at like 10 or 11 o'clock at night, bought 3 fans, pushed all the air through, and then Glenn, the maintenance guy, and I were here almost till midnight, I think, or a little after midnight, and we finally got the HVAC system hodgepodge running to where and this is a totally separate issue, not just because of the tornado, but that was how we got it running to where it cooled down the place enough where we could at least say, okay. But, again, had we not come in that night, had I not been out that late, I would have been like, oh yeah, it's probably fine, I'm not, nobody's gonna go in there. It says 84, it's probably 65, it messed up. No, it was like 84 degrees in that room.
So, I think
Does-
kind of go ahead.
Does the county have any idea of what the loss money, the dollars, if something like that happens and you lose all the vaccines and meds?
I guess
Yeah,
to break it up, it's
that's
like $200 a
thousands and
dose for
thousands
something
of
that's
dollars.
Right, I mean,
paid
it's-
for.
And
$8.
And the freezers are brand new from COVID. Sorry, the refrigerators are brand new from COVID. The freezers are as well. The refrigerators, I want to say, are like 20 or 30,000 a piece, or 15 or 20,000 a piece, because they're double doors. There's 2 of those, and then there's the 2 freezers. And one freezer did go bad, and they did believe it was due to the heat in that room
I
already.
remember kind
So we replaced that after not being here very long. Now we couldn't say that's 100% what it was, so I didn't make that stink about it. We just went and
Well,
used our money, bought
could-
another one.
Yeah.
Could you, before next week, to Dr. Hendrickson's comment, can we find out if we were to lose everything in the men's room, what would that cost be?
Yeah, we know that those count, the price.
Yeah,
of
can
what
you-
coming in,
And I
so
think
if you
circling back to
varicella,
that, the overarching
COVID,
theme here
19.
is, you're not paying for 100% functional space.
Correct.
So, why, this is, to me, something that is reasonable to have discussions about. So, that's my final thought on that.
I mean, could you ask the commissioner's office about what our variable costs are in the space? Is that a question that's already been asked?
They said the $4 is what our variables. That's their version of our variable cost is.
Okay.
Yeah,
So
where
then
did they
what's
come
the-
up with that number?
That's what that is their number.
That's 50% of $8,
Is
just
that,
coincidentally.
right, is that
It's
based
just-
on private sector models, is that
They
based?
said that is their cost for
Okay.
maintenance and utilities.
So
That's
then
just
what's
their
happening
cost.
to the other $4 per square foot?
That's profit margin.
Well, that's.
Apparently,
That seems like that's profit margin, yeah.
I don't want to speak for them because I don't
Correct,
know.
you're
I'm
right,
just
that's.
with the
yeah.
That's
limited
okay,
information we have.
next
So-
week, we can ask them next week.
Okay, so
Just
come
make sure.
prepared, everyone, with your questions next week.
Be here, unfortunately.
Um,
Mhm.
Okay,
Can't
any
wait.
other,
I'm excited
anything?
now.
Cannot wait.
Yeah, he's
October
ready to
4th.
go.
Saturday, so the whole first week.
Bring the popcorn. Okay, any other old business?
I don't think so.
Adam or anyone else?
That's enough.
Plenty of stuff.
Just me.
I know, I just realized we still have new business.
Yeah, well, okay, so new business, I have to.
I don't know any of this.
Alright, so I need a, motion to approve resolution 23-09-07-01-01, to approve the, financial reports.
So moved.
Second.
Okay, motion by Dr. Hendrickson, second by,
Roman.
Lynn Roman. Is this a roll call?
Yes.
Okay, roll call vote.
Dr. Henderson,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brazier.
Yes. Okay, so that,
And
oh,
Crystal.
sorry, hold on one second. Where did I put, oh, Dr. Hendrickson, right?
Yep.
And then
Representative, okay. Sorry guys, I'll give you 1 second, and then Lynn Roman seconded. And we had, how many of us are 4 ayes, 0 nays? Okay, and do we sign up here, Adam, or we just write?
That one you're gonna sign.
Okay. You think I remember this after this point,
It
but-
still throws me off because the formatting is
I know,
weird.
it's all, they're all different.
6:30 gets a little fun.
I know.
Yeah, that's also true.
Getting all
Hungry.
heated about the rent issue too.
The next 2 are just approvals, and that's it. They're not signatures.
Okay, so,
There you are.
but this is not,
That's number 4 technically.
that's number 4,
Yeah.
okay.
Okay, hold on, wait.
So what are the appropriations for increase, decrease?
Well, so the permission to pay McDonald Hopkins settlement agreement, that was the amount that was not covered by a PO. So that's
Oh,
what we're gonna
what's
settle.
this .02, what's that one?
I have permission to settle.
No, that's what I've got.
Oh, sorry,
Mine
mine's old.
signed.
The,
We need a permission to approve appropriations for
yep,
increase.
sorry, that was the only change.
Okay,
That's for
I didn't see
unemployment.
any blank spaces.
We have used up the amount that we had,
okay,
so we're increasing that by 15,000, and that should hopefully cover the rest. It depends on when people get off the unemployment, is what it comes down to.
alright guys, so we need to, permission to approve appropriations for increase, decrease. So we're going to increase the unemployment fund by $15,000. Is there a motion?
So moved.
Motion-
Second.
Motion by Dr. Jones, second by Dr. Hendrickson. Is this a roll?
Yeah, I'll do a roll call.
Roll call.
Dr. Henderson,
Yes.
Ms. Roman,
Yes.
Ms. Jones?
Yes.
Ms. Brackey?
Yes. Alright, so that passes, and this one's coming down for signature. Okay, 7.01.03, then and now, purchase order to DEX, or DEX Imaging, not to exceed $7,926.
So that is for a copier that was purchased, that the PO was closed in, I think it was January, that should not have been closed. It's different staff now, I'm not even gonna second guess or guess why it was closed, but it's closed.
Okay,
But we had already purchased it and already received it, and now we're trying to after the fact get them paid, which they're not super excited about.
so is there a motion?
So moved.
Second.
Alright, so motion by Dr. Jones and a second by
Roman.
Lynn Roman. Okay,
Dr. Henderson,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brackey.
yes,
Alright.
okay. Moving on, this is when I get so confused, there's so much paperwork, just
Yes.
going all over the place.
Rapid fire,
Okay, I
just-
know, it's like, here, that one goes the other way.
Oh, I'm sorry, yep,
See, you got
case in
confused.
point.
Alright, resolution 2003-19, then and now, purchase order to McDonald Hopkins, not to exceed $6,568.40.
And that was again over the PO that we had, so we're still settling up those.
Okay. Is there a motion to approve the, resolution 2023-19?
So moved.
Second.
Okay. Roll call, Adam?
Yes, Dr. Henderson,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brackey.
Yes. Okay. All right, now moving on to resolution, 2023-20, resolution offering the payment of the then now purchase order to Donemark.
So this is for the phase 1 of the wells. This was the remainder that was over what the original PO was, but the work was done way before, so when they invoiced us, it was not enough. And that was due to, one gentleman was Amish, did not want the
with an air
Air
No.
pump, yeah.
Yeah.
I want to say air pump, I thought I was wrong. So it said they had to go find a solar, or not solar, then find it wasn't air pump he wanted, sorry.
Yeah.
We had to go find the air pump, which was in Pennsylvania. It's a whole thing, and it increased the cost of what we were doing. But it made him whole, and the
All right.
EPA is paying for it.
Okay, very good. So is there a motion to accept resolution 2023-20?
So moved.
Second,
Second.
roll call vote.
Dr. Henderson?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
Yes.
Ms. Brackey?
Yes. Is that it? Oh, no, one more.
One more.
Biosolutions. Okay, resolution 2023-21 is a resolution authorizing the payment of a then now purchase order to Biosolutions.
And this is just for sampling costs.
Am I
That
able
was
to vote on
Booth
this?
Park.
I know it's a
Yeah,
done
I think it's
now,
Park
but
Run.
it is.
Some of these were honestly
Well,
what we're finding is they're one-time costs that weren't planned, and so as we're getting into the process of doing all this, there's a couple like this that slip through.
Would you prefer that I don't vote on Biosolutions, or since it's sampling related, I know it's for wells, but I just,
I mean, it doesn't hurt. I mean, there's three
I'll
other people you
abstain,
can
yeah.
abstain, yeah.
Yeah, I
Okay.
don't believe there's conflict, but safe,
for the sake of consistency.
be safe.
Okay, is there a motion to approve resolution 2023-21?
I so moved.
Okay, second,
Second.
roll call vote.
Dr. Henderson?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
Abstain.
Ms. Brackey?
Yes. Okay. Permission to approve settlement agreement with Brian By.
Yeah, so that should be Kastura's. So what that was doing was that settlement agreement is it's how we settled up with them because the PO was not, or sorry.
That's a different one, probably.
Oh, that's the other
That's to
guy.
repair
Oh
a
my
septic
gosh.
system.
We did that one. We did that one in July. So this gentleman had his septic tank inspected, and they switched it on to it's a run mode. It was left on run mode, and when the next morning his alarm was going off, they went out and inspected it, and it had been left in run mode. So
Okay.
unfortunately, it burned it
Ran
up.
all night.
He got a really good price on the motor, though. I tell you what, I don't think any of us thought that would come down as low as it was. So unfortunately, and Dan and I talked, it's something we're gonna have to account for in the future because we do 5 or 6 or 7,000 of these in a year.
Yeah, it's gonna happen.
It's gonna happen.
Yeah.
Yeah.
So
And
it
it's-
was an accident, whereas, yeah.
Educational moment.
Yeah.
Yes. Yeah. That is a tough side with when you. Because the reason why black people tend to work in pairs in a lot of industries is because the second person catches the first person's mistake. With us, I mean, the fees would be astronomical if we double up sanitarians, but instead, that is one downside. There's no one to say,
Safeguard.
hey, you got to remove this, or I'm the checker of that.
Yeah.
I think of the road construction guys, right? Somebody backs up, somebody's behind them, making sure there's nobody coming they can't see.
Yeah.
In our case, we don't have that ability.
Okay, so is there, so what is the settlement agreement?
The settlement agreement was literally, he signed a 8-page document saying he would not sue us. He agrees that we are making him whole again, and that he's getting a $352, $310 pump that is replaced already.
Okay.
That seems like a not that expensive mistake.
It was,
In the grand scheme
it was
of things.
way
Yeah.
less than we thought
Less
it
than
was
the
going
whole
to be.
system
Way
cost.
less, 2 people.
And he was very hospitable. I mean, the gentleman
They got a new pump.
make me whole.
Okay, very
Alright.
new, alright.
10-year-old system with new pump now, I'm good.
Baffled by the wheels of government taking a few months to get them paid, but
That was the
What's
hardest
new?
part to swallow.
and that's
Right.
the most embarrassing thing. is-
Government, Walker, that's what they have.
All right, is there a motion to approve a settlement agreement with Brian By for repair of the septic system?
So moved.
Second.
All in favor?
Aye.
Aye.
Yes.
Actually, we'll do a roll call.
I
I just
was
want to be
gonna say,
careful
I need
because
to
we don't
abstain.
really do settlements usually. So,
Okay.
Dr. Hendrickson,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Abstain.
and Ms. Brackey.
Yes.
I realized why I was off. Somehow I have a July 36th agenda here in front of me. So I'm like, it said Brian Kastura. So I'm like, yeah, it's the next one. I'm like,
I was like,
no,
what are you talking about? That's
July 26th.
I'm like, Adam, come on. Okay, so you want to talk about all these legal actions? Dan, I
Yeah.
assume this is your.
Yep, so we're going through old files through there, and so a lot of them have documented public health failures that weren't addressed in the past. So what we've tried to do is send letters to these homeowners and saying, hey, by the way, we have this failure, we gave you 30 or 60 days in 2020 to fix it, and there's no resolution on record what's going on, and they don't respond to us at all. And so we get to the point where they've had no response to us, so we've sent them a letter saying, hey, we have a documented public health nuisance at your property. If you haven't responded, we're gonna take you to the board, please refer them to the prosecutor's office to address the public health nuisance. So that's what these are about. This week, since we've sent these letters out, I've had all 4 people call me since then, when there's been no contact before. One guy, and so we've actually gone out and retested a couple, because they all said, well, one guy is actually supposedly in the middle of getting his actually installed this week.
Oh.
But until I see the inspection reports and finals, I prefer to keep the train rolling. We had one person, we went out and retested their system, and he said it was working, and it failed right away with dye blowing out. And we have one other dye test going on currently, because they said it's working, because I figured it's been 2 years, we should give them, if they're gonna tell me it's working, then I'll give them the benefit of the doubt.
Yeah.
So that's going on right now, so, but I figured if you at least go forward with letting us, referring to the prosecutor's office, hopefully by the end of this week or beginning next week, I'll have some type of information on 3 of the 4 where we can hopefully not even send it over to the prosecutor's office.
I
We can resolve before then.
Expedites it, due process kind of thing.
Yeah, one of these goes back to 2018.
Yes. Yeah, and, and honestly.
Who was on the
it's
board in 2018?
It's not embarrassing, to-
Ashley wasn't even alive back then.
but, when they're a documented public health threat, or nuisance, then I feel like we do need to follow up on it.
Yeah, I think the one that stood out to me was that the last one, the Eli Miller Jr., just because that was a complaint from a neighbor of raw sewage.
So that one is the one that's supposedly getting installed this week.
Okay.
So hopefully by the end of the week, it will be completed actually, so.
Because, it's
Okay.
been over a year
Yeah.
since the first complaint, and if I was that neighbor, I would not be happy.
So they moved forward initially and got permits and all that kind of stuff, so.
Okay.
But then just like there's this big wall
The wall.
where he disappeared, and then when he got a letter, then he's like, yeah, I just, so
Okay.
I don't know what
Okay.
happened in there's about an 8 or 9 month period where.
Yeah, maybe
Kinda
it was
fell off
on the
the radar a bit.
schedule and something happened, who knows?
All right, so let's just do a one blast motion. So is there a motion to request legal action against Robin and Joseph Henich, Catherine and Ryan Callahan, Irma and Owen Miller Jr., and Eli Miller Jr.?
You asked if there was a motion.
Yes.
Yes.
Okay, so moved
So moved.
by Lynn Roman. Is there a second? I'll second it. And,
Sorry.
yeah, because Ashley's not
No.
gonna stay. So do you wanna roll
Yeah.
call this? All right.
Dr. Hendrickson,
Yes.
Lynn Roman,
Yes.
Ms. Jones,
Abstain.
Ms. Brady.
Yes.
We probably will on a regular basis be having some of these, we catch up with old files that are on the shelves, unfortunately.
Yeah, we had started this process before and then it kind of fell off,
Yeah.
so.
Yep.
All right.
All right.
Let's move on to citizens' remarks. Adam, do you wanna give
We have to do the agreements.
oh, those
Remember-
have to come down?
Yeah, the memorandum of understanding. These are the ones that I need signed, so these are not, please, I need these back. Lynn, I did write your name underneath the line because it crossed the next page. So these are the ones I sent you in advance, these memorandum of understanding. You're gonna see the county commissioners have to approve these, soil and water, the township trustees, benefits for them, the board of health, and soil and water again. So I'm gonna pass these down, you can read them, I'm just turning to the page that starts this, you're on the next page on that one.
Okay. So do you wanna explain what this is?
Yeah.
Adam?
Yeah, Dan, you wanna go ahead and do these ones?
So,
More than one.
it's a phase 2 stormwater plan, so usually when you have more developed areas, they fall under a phase 2 stormwater plan, which is they have to develop a plan on how they're handling their stormwater and how they're taking care of any stormwater issues, which may be, a business has a drain going into the storm sewer where it should go,
Sewer.
or a failing septic system. So what this is just part of the
Yeah,
plan
I just write
for
this
soil and
down.
water to
Yeah.
address
Sign it.
stormwater issues in those areas. Our portion of this is no more than what we would typically do when we get a complaint for failing septic system or any of the sampling we do for septic systems. So really, once a year, we send a report over to them to be included in their yearly reports.
So those are the 3 memorandum of understandings for those. That is,
Yeah,
they're all
okay.
different. They're all the
Sure.
exact same document, but they're different. There's the 3 townships on there.
Okay.
And then we have to send these back to the other side because obviously the county commissioners still have to sign one of these. I think soil and water is the bottom left, they still have to go to.
Yeah.
So we'll have to send those back to them so they can process it on their side. Like
Okay.
Dan said, there's not a whole lot, I mean, it's not.
Anything else before we go to, public comment?
I do not believe so.
That's for, it's just the minutes.
No, okay. I'm like,
Yeah,
oh my
sorry.
God, what month is it?
Number
Don't.
five. Sorry, I had those
Sleep deprived.
the end of my packet.
We had to
We had a
add,
lot of paperwork.
we had to
last
add
time.
so many things to
Why
this.
did I have that on there?
We had
I
like
just closed my
4
notes.
of
I
these
was
things
looking
were
at
added
yours.
like today because they came at the last minute. We had to push everything out like at the
I
last
was more
minute.
concerned when mine looked different.
Yours
Sign
is
your
just
name.
fine.
I'm like, what did
Yours
I
is
do?
just fine, Ashley.
I know.
Alright, okay.
I did that.
Any public
stuff.
comment? No?
I think you're ready to get out of here.
Good public comment.
Yeah.
He also loved his wife, I heard.
Yeah.
It's his date night for Ed and his wife.
McDonald's.
There we go.
Super size.
Alright, we got 3 back. Okay, so let's adjourn at 6:35 PM.
Yeah.